some clinicians, wound care seems difficult, confusing, and filled with legal pitfalls. To others, it's a straightforward process that they manage confidently, enhancing the patient's health and well-being. What's the difference? Knowledge of the clinical management and legal aspects of wound care. And this video is designed to provide and sharpen your knowledge. As you know, there are various types of wounds: arterial, venous, diabetic, and surgical wounds, as well as burns and pressure ulcers. This video focuses on pressure ulcers. After viewing it, you will be able to correctly identify common causes of pressure ulcers, accurately stage pressure ulcers, and describe how they heal, assess at-risk patients, and take steps to prevent skin breakdown. Properly assess and treat or recommend treatment for pressure ulcers, and enhance your documentation, whether it's used for medical, legal, or financial purposes. The video also will bring you up to date on legal issues related to pressure ulcers. Every time you see this logo, you'll learn about a vital legal consideration. Nurses today have a lot more responsibility than they used to. But with increased clinical responsibility comes an increased risk of legal liability. To help you minimize your liability, this video will identify the components of a lawsuit, point out legal pitfalls in pressure ulcer care, and demonstrate ways to reduce your risk of being sued or of losing a lawsuit. Because you may see pressure ulcers in people who range from hospital patients to long-term care residents to home care clients, we'll call them all your patients to keep things simple. And because you may work for a hospital, long-term care facility, home care agency, or other institution, we'll use the term facility for consistency. Now let's begin with a brief review of the causes of pressure ulcers. Generally, pressure ulcers can be caused by pressure, shear, or friction. You must determine the cause of any pressure ulcer so you can eliminate it and treat the ulcer appropriately. To identify the cause of a pressure ulcer accurately, consider the Prediction and Prevention Guidelines of the Agency for Healthcare Policy and Research, or AHCPR. They state that a pressure ulcer may arise when unrelieved pressure damages underlying tissue. This type of ulcer usually occurs over a bony prominence. For example, if a patient with a stroke sits in a wheelchair for a prolonged time, leans to one side, and doesn't change positions frequently enough to relieve pressure, he may develop a unilateral pressure ulcer over an ischial tuberosity. The AHCPR guidelines also explain that a pressure ulcer may result from shear, when adjacent parts of the body slide across each other, producing a shearing force that twists and distorts blood vessels. For example, if the head of the bed is elevated above 30 degrees, a patient's skin may stick to the bed linen, while her deeper tissues slide down with her skeleton. This causes a shearing force that may result in tissue ischemia and necrosis, especially in the sacral or coccygeal area. The AHCPR guidelines also note that tissue damage may be caused by friction when the skin rubs against a support surface. Friction causes mechanical destruction of cutaneous tissue, producing a superficial abrasion or blister, especially where the skin is moist. For example, if a patient is lifted in bed without using a draw sheet, his skin may drag across the bed linen, causing friction, which may produce an ulcer, especially on the buttocks. By assessing a pressure ulcer's location and any affected bony prominences, you can help identify its cause and intervene appropriately. For example, if a superficial pressure ulcer affects the buttocks rather than the sacral or coccygeal areas or ischial tuberosities, suspect friction as the cause. Then intervene by using a draw sheet for lifting or side rolling. Besides pressure, shear, and friction, several other factors can increase your patient's risk of developing pressure ulcers. That's why you should assess the patient's ability to sense and respond to pressure-related discomfort, the degree of skin moisture, degree of physical activity, ability to change and control body position, and usual food intake. So when you perform an initial assessment, use a risk assessment tool such as the Braden scale to document the patient's risk of developing a pressure ulcer or more pressure ulcers. Compare this baseline risk assessment score with all subsequent risk assessments, which should be performed regularly according to your facility's policy. If the assessment score places the patient at risk, take preventive measures and document them in the plan of care to ensure continuity of care by staff members. If appropriate, also explain the measures to the patient and her family caregivers. Document your instruction and the family's acceptance of and compliance with it. Remember that thorough, proper documentation demonstrates adherence to quality assurance or QA indicators and may provide legal protection. Before you can protect yourself legally, you must understand legal liability. Most lawsuits against healthcare professionals are for negligence or malpractice. Simply put, negligence means failing to do something that you should have done or doing something you should not have done. Malpractice is negligence by a professional. To successfully prove negligence or malpractice, the person who's bringing the lawsuit must prove 4 components: duty, breach, causation, and damages. Let's look at each component separately. Duty is the responsibility you owe to the patient. It requires you to act reasonably in your capacity as a healthcare provider. For example, if you're assigned to care for a patient, it's your duty as a nurse to assess his risks and intervene according to the standard of care. This means you must perform these duties as any reasonable nurse would. Breach refers to failure to meet your reasonable duty. If you don't perform timely initial or subsequent risk assessments, or don't intervene properly, a breach of your duty has occurred. Causation means that your actions or inaction directly caused or substantially contributed to the patient's injuries. In this case, a lack of risk assessments and appropriate interventions could substantially contribute to pressure ulcer development or deterioration. Damages refers to the amount of money a court may award the person for injuries caused by your actions or inaction, such as an ulcer that could have been prevented if you had performed risk assessments and intervened properly.